So glad to have you back for the second half hour of the program. We're going to be talking with Erin Thomas, who is a PT, DPT, COMT, and CBFE, the senior physical therapist at Indiana Physical Therapy in Columbia City. And we will explain what all those letters mean a little bit later in the program. But the bottom line here is you are a physical therapist and a doctor of physical therapy.
Yes, about, I would say 15 years ago, they switched it over to the doctorate of physical therapy. So it's a clinical doctorate, but it's 3 years of grad school after your bachelor's.
Yeah, so 7 years of training to be in the clinic, and where some people refer to you guys as what are phrases you've heard? I've heard physical terrorist,
pain and torture.
Pain and torture.
Yeah.
And that's one of the myths that we're going to blow up today is that pain does not have to be a part of this process, right?
Yes, pain is very complex. There's different types. There's differences between actual pain and just discomfort, and pain has an emotional aspect to it too as well. So most physical therapists, every physical therapist should try to make you comfortable and hopefully you trust in the process that we know what we're doing. And so that can kind of take that fear away. And so then the pain isn't as intense as, say, if you're just afraid of what might happen.
So, you might not know it when you look at me, but I do go to the gym and lift weights a couple times a week. But when I'm doing that, you lift to the point of exhaustion, to the point of failure.
Yes.
And am I expected to work that hard in physical therapy?
You might in your last couple of sessions before discharge, but not in the beginning. In the beginning, we're respecting the tissue, the healing process, your pain levels. We want to work under that threshold to help heal the body first. Mm-hmm. But you are expected to do your home exercise program. So you will be doing some exercise at home, and we provide pictures, the resistance bands, or give you some ideas on how you can complete those at home.
So is it valid to take an acetaminophen or an ibuprofen before I come to therapy to help me get through that a little more effectively?
I don't think it's necessary. Oftentimes it could mask what information I need to know from you. I want to know if I'm creating pain because that is your body's protective mechanism. And so if something I choose to do increases or begins that pain, I need to know it. And if you take something, then we might not know that. And then you'll end up in more pain later that evening because we've done too much. And you won't know it till the medication wears off. So, that's different for post-op. If you've had a total shoulder or a total knee, we know therapy is not fun, and we recommend you take your medicine. But if it's just an overuse injury or something non-surgical, there's no need.
So how do I tell you what? It's interesting you said I need to know what hurts so you can change the procedure or whatever I'm doing. So how do I talk to you about that? Do you do the whole 1, 2, 3, 4, 5 thing? That's a 1, that's a 5. How do I tell you about pain?
Sure. We have the 10-point scale. So 10 is, worst pain imaginable, rush you to the hospital pain, and 0 is nothing. But throughout the whole hour that you're with us, we do some manual therapy, hands-on stuff. We do some exercise, and I want to be in constant communication with you. There are certain things in your low back that might prefer one kind of hands-on treatment versus another. And so I need to hear from you, it was just painful, but now it's tingling all the way to my toes. That's not so great. So let's try something different. That way it helps me pinpoint exactly what will benefit you the most.
Gotcha. That makes a lot of sense. There are some things that happen in physical therapy that aren't necessarily pleasant. The word massage in physical therapy doesn't necessarily mean what it means at the spa.
Yes.
So what might be uncomfortable in that process?
So yes, discomfort is definitely a possibility because it's part of life. You'll feel uncomfortable every day, parts of your day, whether you sit too long or stand too long or whatnot. We have to do sometimes we'll do deep tissue massage, sometimes we'll do joint mobilizations. There'll be pressure, there might be some stretching and pulling, but we're not looking to cause that sharp or severe pain.
Sure.
That would indicate a problem. So all pain does not equal damage or does not equal injury. And really our brain receives the signal of pain in the same way it receives all the other signals, that it feels pressure and hot and cold and all that, and it decides for whatever its threshold is, whether it's pain or whether it's hot or whether it's cold. And so sometimes with chronic pain, like after 6 months or so, your brain can start thinking things are painful that aren't really painful. And so we have to re-educate that process as well.
Oh, interesting. Yeah.
Yeah.
So one of the things that's changed recently is how I get to see you. In Indiana, I used to have a physician's referral. So that's one of the myths, is that you got to go see your doctor, you got to go get your x-rays and get an MRI first, correct?
Correct. Yes. We have 42 calendar days now where we can treat you. You're just walking off the street. You've been raking all weekend, and Monday morning you wake up and your shoulder's just throbbing. You know it's your shoulder. You know it's orthopedic. Come see us. We can get you in quickly. We'll get you started on what you need to do. And hopefully that will shorten the amount of time that you're in pain, that you're having your dysfunction.
And it's easy to do. You can just go to IPT.com, right?
Yes.
Or IndianaPT.com.
Yes.
IndianaPT.com, and the phone number's there. They have multiple clinics, and there's one close to you. I think 18 clinics around the state?
Yes. We actually just opened the most recent one in Indianapolis, but we have the rest of them are up here in the northeast corner, all the way to Angola, Bluffton, Decatur, Goshen, Elkhart, Warsaw, Columbia City.
Yeah, so there's one close to you. Yeah,
several in Fort Wayne.
So what about that whole I need images first? Do you need x-rays? Do you need an MRI?
We don't typically need them right away. We treat for about 2 weeks, and then we reevaluate, and we see, are we really making progress? Are we seeing any improvement? And at that point, if things aren't going along the way that we thought they should be, then that imaging can be helpful. If you've already had it, then by all means, it's a piece of the puzzle. But with our degree, we learn how to determine different diagnoses. Shoulder pain in everyone is not the same. And so we figure out if it's rotator cuff or is it frozen shoulder or whatnot. And we can do a pretty good job figuring that out even without an MRI or an X-ray. They're just like two-dimensional pictures, and just because something's on that picture doesn't mean it's creating your pain or your issue. So sometimes it can kind of muddy the waters, so to say. If there's, say, a disc protrusion in your low back, and then you start having back pain, that doesn't mean that disc protrusion hasn't been there for years and years and you've had pain-free, and maybe you just strained a muscle last week.
Yeah.
So we don't want to get distracted by that if we don't need to.
You just used a phrase there that I'd not heard before, frozen shoulder. Give me 30 seconds on what that is.
That's an inflammatory response to the sac around your shoulder joint.
So the bursa.
The capsule.
The capsule,
that holds in the fluid that keeps your joint moving well. It becomes very inflamed. It becomes very painful, and then you start to lose motion because of how significantly painful it is.
Okay, and your treatment for that is get it moving again, work through that?
Some light stretching. It's not something that you want to go in and crank on a lot because then that can increase your inflammatory response.
Sure.
But we'll try to maximize what motion you have available, and it's actually kind of interesting that over time it kind of goes through its path and it'll start loosening up, but we just maintain or try to maximize the function you do have until that happens.
So glad to have you as part of our program today. We are speaking with Erin Thomas. She is the senior physical therapist at the Columbia City Clinic for Indiana Physical Therapy. And on the line with us is Mr. Montgomery from Markle. Sir, I will call you sir since you introduced yourself as Mr. Montgomery. What is your question for Erin today?
All right. Wanted to know, I'm a 73-year-old old geezer and retired, but I've been told that I've got bone spurs in my elbow, and is there anything that physical therapy can do for that?
Oh, good question.
Okay, so the first day you come in, we would do a very detailed evaluation, see what kind of range of motion deficits you might have, strength deficits you might have, and at Indiana PT, we have the largest number of certified orthopedic manual therapists on staff. in the country, or one of the largest groups. So many of our, or all of our PTs can do some hands-on treatment that could help loosen the joint a little bit for you, to get that motion better if you're lacking. And then we would really focus on just what is difficult for you to do every day because of this, and try to address that with certain exercises, stretches, whatever we might deem necessary to help you live your best life.
Well, let's dig into that a little bit. How does this trouble you? How does it feel? What can you not do?
I don't want to say I can't do anything, but it is just a lot of pain all the time, and it's very, very difficult, especially in certain movements and stuff like that I have, and just regular daily activities and everything. And so, it's just, I've had the x-rays and stuff like that, but they told me that if I thought maybe you could just go in with a belt sander or grinder or something like that, and get rid of all the spurs and everything else like that. But they said it's not that simple, that, if you have to have the surgery to take care of it, it can knock you out for over 8 weeks or something like that. And so I just, I'm just not quite ready to go through all that, and so that's why I wanted to see if there was anything that, physical therapy itself could help with and everything, in trying to get some relief from the
Aaron,
bad discomfort from that.
Aaron, I know you don't know his particulars, but with that kind of a problem, what are you likely to do? What would his therapy likely be?
Oh, well, we would typically, I would address that joint restriction with some mobilizations, whether it was he couldn't extend it all the way or he couldn't bend it all the way. Both things are needed for function. You got to be able to bend that elbow to feed yourself. You got to be able to straighten the arm to drive, etc. So we would do some hands-on treatment. It might be 10, 15, 20 minutes, depending on what he might need. And then,
that hands-on treatment is doing what? Tell me what you are accomplishing with that hands-on treatment.
With the elbow, we can get in there. We can stabilize the humerus. We can move the ulna, which is the bigger bone of your arm that makes up your elbow point. We can move those on each other. It helps to calm down some neural tension around there, some neuromuscular tension.
Keep going. Yeah, he just dropped off the line.
It can help loosen the joint a little bit there to help improve his range of motion. Then we'll teach him some stretches to continue to do at home to maintain that mobility, because it's not that the hour or two that you spend with us in the clinic every week. It's what you do at home frequently throughout the day at work or whatnot that will give you the best benefit.
He said something there that I think is important, and it kind of gets to one of the myths, and that is that you have to have had injury, an accident, or surgery to need physical therapy. He's looking to you guys to avoid going into surgery.
Yes, a lot of times we'll see patients who have just had a decline in function, whether they've developed osteoarthritis in a joint, or maybe they had a knee injury, playing football way back when, and now they've gotten a lot of stiffness or weakness on that side because of just prolonged avoidance, babying it, if you will.
Yeah.
Those muscles get weak. That puts a lot of strain on the joints. So getting those muscles stronger, getting your tight muscles more flexible, it can take the stress off the joint and really take away a lot of that pain.
One of the myths out there is that anybody can really do physical therapy. Lots of different professionals can recommend process and procedure, but
Sure.
I know you guys go through a great amount of training. So we talked about DPT, a Doctor of Physical Therapy. That's your designation.
Yes.
COMT is another one of your designations, and you just mentioned that, Certified Orthopedic Manual Therapist.
Yes.
And what does that mean?
That was it took a couple years, a whole process of learning the proper way to differentially diagnose things. It was a way of thinking about how to find the patterns, how to figure out what's wrong, because no matter what I do for you, if it's not to address what is actually wrong with you, then I'm not going to get you better. So we got to know what's going on first.
Sure.
But it was after graduation. You would take a weekend class, you'd practice it for a while, you'd go back, get more training, practice, and then you sit through a very intensive hands-on test and written test to get that designation. So.
And this is when you're actually manipulating tissues, right? You're touching, moving, stretching, yep. All those things.
Yes, moving joints, stretching tissue, trying to decompress if that's needed.
What is the CBFE behind your name? I've never heard that one.
That's actually related to our functional capacity evaluations. So the letters stand for Certified Blankenship Functional Evaluator, and that's just the program that I went through to become certified to do that functional capacity evaluation. That is to determine your current level of function. So you have had an injury or an illness or something, and you're trying to determine what kind of job might be appropriate for you, or maybe perhaps, if you have a really life-altering issue like MS or something like that, we could do it for disability purposes.
Understood. So one of the things that some people don't understand is that today, most insurance plans do cover physical therapy. So kind of a myth that it's going to be expensive and difficult to be able to get access and get covered for that, right?
Right, exactly. Indiana Physical Therapy, we accept all insurances. So we will call on them. You give us your information. We'll get your coverage for you. We'll let you know what it is.
So I don't have to do a lot of the paperwork myself and go in that pre-auth thing and all that stuff?
Exactly. Yep. Okay. We take care of that for you. I would say a very high percentage of them will allow that direct access as well. The small amount that won't, we'll call over to your doctor, whichever you prefer, and try to get that paperwork signed. And
typically a copay for the service?
It all depends on your specific plan. Mm-hmm. So copays are something you pay each time you come, but then typically I would say you probably won't have a bill at the end. So there's benefits to both ways. Maybe you won't have a copay, but then you'll get the bill at the end. But we do a process where we try to estimate your cost so that you know ahead of time, and you can prepay on that so that you're not getting that bill.
Yeah, not a big shocker.
All at the end.
Tell me more about what's helpful for you to hear when I come in. Do I need to have a list of all the problems I've got? How do I come prepared to you so that first appointment is really effective and a good use of both of our time?
I think just being aware of your pain and when it happens, what causes it, maybe what makes it feel better. That mm-hmm. helps me to determine things as well. What treatments you've had and were they helpful or not helpful. Kind of the timeline of things helps. But we all have our huge long list of very detailed questions we'll ask you. So just the patience and the truthfulness to answer them all accurately will really help us to determine what's going on with you and then get you on the right plan of care.
Awesome. That is Erin Thomas. She is, as I said earlier, the senior physical therapist at Indiana Physical Therapy's Columbia City Clinic. They have 19 locations around the state. You can find Indiana Physical Therapy online at indianapt.com. And I'm not even going to bother giving you the phone number. You'll just go grab it unless you know it off the top of your head.
Well, there's a different phone number for every clinic, but they're all listed there on the website. And we are open 7 to 7 Monday through Thursday, 7 to 6 on Fridays. So we take that last appointment at 6 p.m. to allow you to get in.
Excellent. Thank you, Erin. Good job. Thanks for helping us understand a little more about some of the myths that we may have known about.
Thank you.
Physical therapy.